followed the journeys of individual patients represented here. Red bars show waiting time, green the productive face-to-face time with a clinician. And as you can see, the balance was completely wrong. The time we spent sitting watching in outpatients gave us some real insight into the patient's experience, into the waste, the duplication, the poor layout, but of course the opportunities.
What we did, and one of the first things I'd just like to draw your attention to is that when we developed this programme, that when we brought in the external expertise to develop the productive outpatients with us and pilot it, the pilot alone over 2 large clinic groups cost us £35,000. Now, to take that and to spread that right across our organisation would have cost us 10 million because of the size of the organisation. But more importantly, what we wanted to do was actually have sustainable skills within our organisation so that it could be replicated and spread and adopted. And also, if I draw you back to the case for change that Jill's alluded to, one of the critical points for us was that our clinicians felt out of control of their clinics. Our frontline staff felt their clinics were out of control. So it was fundamental that our objectives were about engaging, training and empowering frontline staff with the skills so that they could do this. So in essence, our objectives became building local capability so they could redesign the services themselves, actually going through the redesign process. But what we also recognised, there was no national toolkit that we could take. So what we wanted to do was develop the productive outpatient toolkit and the methodology, and that's what we did.
And here are some of the examples of the benefits we've realised so far. To date, we've demonstrated better patient experience, we've reduced waiting, we've improved access for referrers, we've streamlined processes and released staff time, we've freed up clinic capacity, and we've cut the costs of duplicated work. As Janine mentioned, we've already launched productive diagnostics and ambulatory care as an offshoot, based on the same principles and some of the same packages. And we're now sharing our programme and providing support to some other trusts. So thank you very much for listening. We're happy to take questions if time permits.